To me, teeth right after surgery is doing the patient a disservice, because what it basically does is they take a denture, and you can see they remount a denture, they drill holes, and then they attach it to these metal cylinders. And to me, this is a disservice because, and this is kind of one of the traditional ways that it's been done, because you have three different materials here. You've got a metal cylinder, and you've got two different types of resin. Almost 100% of the time, patients have to come back multiple times because things break. These three materials don't mix well. So things always break. The back teeth break, things chip, the temp cylinder comes loose, stuff like that. And so really, that is a huge disservice, because then that's more than like within a year, you'll break it 3-4 times. You have to see follow-ups. Not only that, the reason why things start to break is because this is bending. And when things bend, that's when things break. And what it tells me, if it's bending, is also means these implants are possibly moving. So after 24 hours, this is what you get: zirconia, versus this, where you have multiple resins, multiple plastics bending. And so this is really bad for the implants, and you get a higher implant failure rate actually with this prosthetic.
So you brought up the failure rate, and I'm sure a lot of people, that's something they're scared of, right? What if I spend this money? What if they fail? So what is the success rate of dental implants, and particularly at Nuvia?
So dental implants, they do have a failure rate. I think the general dental implant success rate in the literature is about 93 to 97% success rate. I do know that my own success rate is a little over 99%. I've placed over 2,000 implants, and I've kind of tracked my statistics. But I know for Nuvia, their success rate is 99.13%. And so we've been following that success rate since the inception of Nuvia. The only way for this to work is that every minute of the day is being utilized by Nuvia, either the doctors or the lab. Every minute of the day counts. Every minute of the day, every second of the day is needed to make this work. And that's why it's such an amazing process.
With this process being done so quickly, the first thing I would think of is like, oh, this would, cost a lot more than maybe something else. So how would, an everyday person afford dental implants? How are they affording it?
No, that's a good question. That's a very common question that patients ask. Certain things that Nuvia does is to make sure that it helps the patient. One is everything is included in that one price. Typically, if you go somewhere else like an oral surgeon or to another office, they're charging you for bone graft, for membrane, for the implant and all that stuff. So it's like an a la carte style. So the price kind of floats. Up and down. It fluctuates definitely between patients. But at Nuvia, everything is included. Not only that, we have our in-house lab. And so we're not having to pay additional overhead and passing that on to the patient. We have our in-house lab, able to save on costs in terms of that. And then obviously we're able to provide payment plans so that every month it's an easier payment versus a huge lump sum. I do know Nuvia has the Nuvia dental implant cost guide. They can download that, take a look, and see if dental implants are something that they can move forward with.